Dr. Dorner here to talk to you guys a little bit about fluid balance and requirements. And then in the second section today, we're going to talk about acid base. And I wanted to make these as small little videos just to make them kind of in bite-sized pieces so you guys can learn the material and then we can apply it whenever we're in class. So, just an overview of what I want you guys to get out of this lecture, because I think that this is something that's really, really important lecture because it's going to come back and haunt you, not only in this class, but throughout the rest of pharmacy school, and then whenever you actually go into patient care. Because a lot of what we do really does center around what is known as supportive care. And a lot of supportive care is just giving maintenance fluids or giving fluids. So, what I want you guys to get out of this lecture is first, I want you guys to know how to calculate total body water and osmolarity. Also, I want you guys to be able to look at a patient's chart or look at a patient in like actual practice and be able to tell if they're hypo or hypervolemic. Again, this is going to come back and haunt you, whether it be in the AKI section or even later on in this lecture series. We're going to discuss IV fluids and discuss the different types of IV fluids, including what's the difference between a crystalloid and a colloid, and then within each of these classes, each different type of fluid and when to use them. And then finally, we're going to do some calculations for maintenance fluids and talk a little bit about that. Now, some ground rules. So important things to keep in mind. Number one, you can either listen to me talk if you do enjoy my witty banter and really bad jokes, or you can actually just read the module. It's up to you. I left it, all the questions that you're going to get on the exam and everything that I think is important for practice is located in both places. You do not need to know any dosing. I got a lot of feedback from your guys' gen med lectures with me that you guys thought I needed to know dosing. I totally don't. You do have some equations that you're going to be expected to do, the Holiday-Seeger equation and osmolality, and then total body weight. Two of those, the Holiday-Seeger and osmolality equations, are a little bit complicated, so that's why I give them to you guys on your equation worksheet. As far as total body water, you're going to see that it's pretty simple equation, so I don't give that one to you. Reference ranges are given in the exam, and whenever I do your guys' lecture, you're going to hear me talk about fish bones. It's just an abbreviated way of showing lab values. You guys will not need to know exactly like what wishbones or where everything falls in the fishbone. I just do that because it's something that you see in practice. Questions are based off the objectives. I double, triple check to make sure before I even talk to you guys today that like everything matches up. You have case discussions in class, and the reason why we do case discussions in class is because you guys are going to have to apply this material to patients anyway eventually. So I want you guys to be able to do that now and actually start thinking about like where all this fits in. And for that reason, I also have a lot of case-based questions whenever it comes exam time as well. I always like to ask you guys those just again so that I know you guys know the material well enough to take care of a patient.